So this is a 67-year-old man with classical hepatosplenomegaly. There are no signs of chronic liver disease, although indeed this could still be important in the etiology of his hepatosplenomegaly. There are no lymph nodes either, and no other evidence to suggest a hematological malignancy, but this is also important in the differential. For the student to pass this case, we'd expect a good general approach, including washing of the hands and ensuring that they're gentle with the patient. We'd expect the student to inspect, palpate, percuss and auscultate. We would expect the student to pick there is an abnormality, and we would expect the student to at least have some idea of the major diagnosis, differential diagnosis. We'd also expect the student to consider looking outside of the abdomen for other important physical signs of potential relevance, which may include examining for all the lymph nodes properly and a rectal exam, although we would not expect the student, of course, to do a rectal exam in the case. So we'll go to the student now and watch how he does.
Good morning, Mr. Gifford. Just going to be examining your abdomen here.
Okay.
Just going to have a look at your hands first. Okay. Just going to have a bit of a look at your face. I'll pull down your eyelid. Do you want to look up for me? Thank you. And open your mouth. Stick out your tongue. Beautiful. Thanks for that as well. I'm just going to have a bit of a feel. Okay, great. Can I get you to lie down, please? So look at that. I'm just going to have a bit of a look first. You want to take a few breaths for me? A few breaths. Yep, and out. And down. I'm just going to have a light feel. Do you have any pain anywhere?
No.
Beautiful. You got a bit of a deeper feel, let me know at any time if you're in pain. Thank you. Just going to feel for your liver now. Can you take a breath in? And out? And in? And out? And in? And out? And in? Yep. Okay. Beautiful. Thank you. Great, thanks. Just going to feel for your spleen as well. Breath in and out, and in and out, and in and out, and in and out, and in. Yeah, thank you. Now I feel for your kidneys. All right, thanks. have a bit of a listen as well. All right, thank you. That's great. Thank you.
Is there anything else you'd like to do?
Yeah, I'd examine his genitals and do a PR. No.
Anything else?
No.
Okay. Would you like to summarise your findings?
Sure, thank you. This man has a obviously distended abdomen with enlarged palpable liver and a palpable spleen as well. He's got no obvious signs of chronic liver disease, no ascites with abdomen resonant out to the flanks, and no palpable kidneys either.
Can you tell me more about the liver and spleen? What were they like? How big and other characteristics?
Yeah, certainly. Well, the liver was quite enlarged, about 15 centimeters. I didn't hear any bruise, and was soft, and the spleen was soft as well and resonant.
And thank you. How can you be sure it's a spleen and not something else in the left upper quadrant?
Well, I tried to pull out a kidney, and I could not.
Any other characteristics that might tell you it's a spleen rather than a kidney?
Yeah, I couldn't get above the object as well, which makes it more likely to be a spleen as well.
Okay. What do you think is the most likely underlying etiology of the findings?
It's quite possible that it's a complication of chronic liver disease. It could be a hematological complication, or it could be even a cardiac manifestation, although this is probably quite unlikely in this gentleman's case.
All right, thank you.
Thank you.
So you've just seen the student examine this patient. This was an exceptional performance, although like all performances, there are always areas that can be improved. So the student clearly had a very good general approach, was very gentle with the patient, did appropriately examine the abdomen, inspect, palpate, percuss and auscultate. The student did find the hepatosplenomegaly, and the student had a reasonable, short but reasonable differential diagnosis in the case. The only real potential limitations I saw was there was a brief examination of the cervical nodes at the beginning before moving to the abdomen. This was reasonable, but a little bit incomplete. For example, not all the node groups were palpated for, and that may have been a small limitation. And the only other small point is in the bimanual palpation of the spleen, the hand actually that is compressing over the spleen should have been perhaps a little bit higher to allow this to be performed expertly. Otherwise, though, this was a very good performance, and all of the points required to pass were clearly met, and indeed this student performed well above this.